Recently, we have seen a lung transplant patient who actually scaled Mount Everest. It's not new science, it's not sci-fi.
Lungs can recover from years of unhealthy habits.
The first time we give it out, we can just feel the patient jolt back. So that's the miracle of life. I'm an organ donor.
So, welcome to the program, Dr. Tapaswi, and it's a pleasure to have you.
Thank you so much, Dr. Lakshmi.
So, most doctors spend their careers treating a disease, but you get to replace a failing organ, giving someone a second chance at life. So, tell us how transplant medicine is different and perhaps exciting when compared to other specialties.
That's a wonderful question, Dr. Lakshmi. So that's how my career started when I saw damaged, fibrosed lungs being taken out of the chest and being replaced by pink, healthy lungs. That's when I felt, yeah, this is it. That's what drew me to transplant medicine. I tell people that transplant medicine is always an attitude rather than a science per se. It's more of an art where you're so involved with your patient and you watch each step of yours and each step of your team. Be extremely careful for post-transplant outcomes because that's what gives them a breath of new life.
That is when you think, okay, this is what I'm here for.
Yeah, absolutely.
As rightly you said, I think transplant is a mixture of, say, science, teamwork, and miracles.
Absolutely. The donor miracle. Unless a donor is there, every time I see a donor in the OT, when they donate, the family has donated organs in their deepest grief. That's where God lies. That's where God is telling the family and, of course, the donor, when we are alive, if we donate our organs, it's a message from the universe. You keep other people alive after you're gone. So that's the miracle of life. I'm an organ donor. So I urge everyone else also who is okay with it to go forward.
So, when you say lung transplant, doctor, don't you think it sounds very complicated, something like a sci fi movie or something like that? So, how would you like to explain this to everyone?
Lung transplant, like I mentioned, it is changing damaged, diseased lungs and replacing them with new donor lungs who have been kind enough to give donations. So that is lung transplant. Of course, it is very complicated and it's a time-taking procedure. The patient has to wrap his head around the fact that their lungs will be changed. I'd urge general public and other doctors to understand that the earlier the patient comes to us, the better outcome we can give. So it's not new science, it's not sci-fi, but it's not been advertised or not been spoken about more. It's been spoken about only after COVID because people started accepting ECMO and lung transplant after COVID, in spite of the fact that it was existing for almost 9 to 8 years pre-COVID too. So the learning curve for Indian doctors is great right now. Everybody is on top of the game.
So, how do you think the awareness about lung transplant and the acceptance as well? How do you think, where do we stand?
Awareness about lung transplant, I think we are still standing behind because there is kind of a misconception that results are not very good. Unfortunately, we can't urge patients who have done well to go on to social media and talk. They would have other things to think about or bother about rather than create awareness. So, all of us as a medical fraternity should go forward, understand how lung transplant patients are doing post transplant, and yeah, spread awareness about transplantation, and the earlier the better.
So, you mean to say there's still a lot of fear attached when you say, someone needs lung transplant and uncertainty as well?
Absolutely. It's very scary for a patient to hear that he or she needs a lung transplant. The first time we give it out, we can just feel the patient jolt back. So, those are because of the myths surrounding lung transplantation. The first myth being results. Patients are very skeptical about results. I think rather than talking to someone who has never done a transplant, I would urge people to come to transplant centers, take the transplant pulmonologist or transplant surgeon's opinion. It's definitely worthwhile for advanced lung disease patients or patients on chronic oxygen to take an opinion so that they know where they stand in their treatment timeline. I wouldn't say every patient on oxygen needs a lung transplantation. So we can manage them medically, especially depending on the age and comorbidities. Every patient on oxygen doesn't need a transplant. But if someone could do well with a lung transplant, yeah. So they are the people who would definitely benefit from meeting a transplant pulmonologist. So the myths would be bursted, especially in terms of results. Second thing, patients feel they can never go back to their normal life.
Yeah.
Recently, we have seen a lung transplant patient who actually scaled Mount Everest 3 years post transplant. So it's not far away that all of us achieve those results here.
That's incredible.
Yeah, it's all about in the mindset. We need people, patients who are very well motivated, driven, rather than driven by fear when they have to go ahead with the transplantation. Third thing is the number of drugs. Patients have this opinion that they'll dump me with a ton of pills even after we are giving a new organ. That's also not true. After the first 6 months, the number of medicines slowly, steadily come down once the new organ is accepted by the body and they're not so much susceptible to infections. Everything settles down over time.
So you mean to say, after transplant, anyone can live a pretty normal life just like any other person?
A little bit more careful when just in terms of infections. I tell my respiratory asthma patients or COPD patients also the same precautions. Please use a mask when you go into crowds. Please be up to date with your vaccinations. Keep meeting your healthcare practitioner time to time.
What was the youngest and the oldest patient you have seen in your career undergoing lung transplant, doctor?
The youngest patient I have seen almost 8 years ago was in Chennai, and that was an 8-year-old child who had cystic fibrosis. And the oldest was 69 years old, who was a post liver transplant patient who had lung fibrosis as well. So it's a wide spectrum, it's not subjugated to particular age group. Lung transplantation might be required at any point in time.
So, what do you think are some of the biggest threats to lungs that we do every day? I mean, apart from smoking, I mean, we all know smoking damages pretty much every organ in the body.
Like you rightly said, Dr. Lakshmi, biggest threat is smoking. It's not only smoking for ourselves, somebody next to you, secondhand smoke. Somebody next to you smoking also is a threat to lungs. And now we are talking about secondhand smoke and even third hand smoke. Somebody smokes and they take that smoke with their clothes or with their belongings home. Even that is causing asthma in children. So first hand, second hand, third hand smoke, these have to be avoided. Second thing is, I can quote Delhi, pollution is the biggest threat, and keep your lungs healthier by taking timely vaccinations. The other threat is easy spread of tuberculosis in India.
So, do you think lungs can recover from years of unhealthy habits? Is that possible?
Of course, it is possible. They would take some time. Like if I stop smoking today, I can't expect my lungs to be okay tomorrow. But they would take their own time to recover. The timeline could probably be 2.5 to 3 years, 5 years, and in some people 10 years. But it's not like I've started smoking and I live with this because anyway my lungs are damaged. How much life would you promise me, doctor? That's a valid question, but I would like to answer it by saying that you will definitely recover, and probably by stopping today in terms of smoking or in terms of post TB destroyed lung, once you start taking care of your lungs, yeah, they respond. I personally vouch to say that lungs are a very resilient and very tolerant organ. They kind of hold the fort until every organ in the body fails. So yeah, they do recover.
So, how about people when they come to you and say, I didn't expect my lungs to get affected because I haven't smoked in my life? What do you have to say?
It's pretty sad that people have taken care of their lungs and still this happened. But for them, I would say let's look forward rather than backward. I had a patient who didn't have any habits, but she's a scientist who happened to work in a lab which has fungal cultures. So unfortunately, they don't know at that point of time they're being exposed to some amount of asbestos along with fungus. So she developed a fungal ball. She's very angry that this happened, but yeah, that's part of our psychological counseling where we try to tell them to move forward rather than look backwards.
So, talking about second chances at life, doctor, I'm sure many people support organ donation only in theory. So, what would you like to tell them, or what do you think they should know about organ donation when it comes to reality?
Yeah, so organ donation, there are lots of myths surrounding organ donation, especially religious conflicts in their own mindset. So, organ donation is something which can give life to a lot of people, like eyes, kidneys, liver, lungs, and heart. I'd like to tell them that when patients come out after an organ donation, it's miraculous. In your grief, if you could go that one step forward and try and help someone else, it's always a circle, full circle, where you see someone else living through the organs of your loved one. It's a big, big decision, bold and beautiful decision, I'd say. But if you can heal someone through your grief, maybe nothing beyond that. So that's why I'd like to urge people to go ahead with organ donation. In the West, in fact, you opt out of organ donation. In India, you opt in. So somewhere there would probably be some reforms if doctors, general public, politicians, and religious leaders come together and take a decision on organ donation. Because Europe, where we have trained, I've seen organs come in like every other night. Kind of seen some 5 lung transplants in 3 days. So I just keep wondering, we are a billion population. Why aren't we getting so many organs? So abroad, every person is an organ donor by birth. If you don't want to donate, you opt out. So maybe somewhere we are a long way from there, but yeah.
So, I think every organ donor is a silent hero, giving second chance at life to so many lives.
Absolutely.
So, as a pulmonologist and now a transplant physician, doctor, what are some habits that you have inculcated in your lifestyle?
Like I already said, we mask up even now. That's what COVID has taught us. That's what transplant medicine has taught us. Please stick to your masks in crowded places. That's what will help you from infections. Make sure your vaccinations are up to date and a very, very healthy diet, high protein, rich in vitamins and minerals. Please make sure you're having your regular exercises every day. I mean, even my pre-transplant patients, they take their medicines. I don't have to push them, but I make sure they exercise. Exercise keeps you up to date. Post-transplant as well. We ask them to exercise so that they can get up and get going the minute their ventilator is off.
And finally, doctor, what message you would like to share with our viewers out there as far as lung transplant is concerned?
Please give way your myths and folklore about lung transplantation. It's a science which has evolved very well in our subcontinent. Don't think that you come to a transplant pulmonologist, they will put you up for a transplant. It's not that way. We could medically manage fibrosis patients and chronic obstructive pulmonary disease patients. If not lung transplant, we would be offering you other good medical practices and medicines to make your life better. So I think lung health and advanced lung disease has gone pretty much a long way, where we can help a lot of patients if we are approached at the right time.
So, thank you, doctor. It was wonderful having a conversation with you. Thank you so much.
Thank you, Dr. Lakshmi.